afternoon. I'm Dr. Nivedita, Junior Consultant in Iron Tagore Hospital, Mukundapur. Today, I'm going to tell about some details about hypertension. So in our today's discussion will be on what blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. It creates pressure against the walls of blood vessels. This is called as a blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when the pressure remains high for a long time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over the time, and it can happen because of unhealthy lifestyle choices. For example, not having enough regular activities, obesity, smoking, alcohol consumption, and stress. And there are other risk factors that can also increase the risk of development hypertension, like age. Like as people age, लोगों की जब एज बढ़ जाती है, तब आर्टरीज जो है वो स्टिफ होने लग जाते हैं एंड नैरो होना शुरू हो जाते हैं. So that is the cause of hypertension. And family history of blood pressure. If someone parents had a family history of blood pressure, hypertension, it increases the person's risk of developing the condition. Excess salt intake is also known to raise the blood pressure. Not eating enough food with the potassium can increase also blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty food increases the fats throughout the body and make it, heart work harder to pump the blood throughout the body. Hence causes blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Nowadays, it's reacting to stress in unhealthy ways or not managing stress can also increases the blood pressure. So moving on, the hypertension doesn't have any obvious signs and symptoms. And that's why it's called the silent killer. It puts people at risk of several diseases, from cardiovascular problem to the kidney failure, stroke, even eye damages and blindness. Hence, the early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person have had blood pressure or not. Generally, when symptoms do occur, they include morning headache, tiredness, vision changes, boozing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of those symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. So it is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually means. Like, in a healthy and normal person, it should be 120 by 80 mmHg, or it can also read as a 120 over 80 mmHg. Here, the upper number indicates the systolic blood pressure. It means the pressure in the blood vessels when the heart contracts, and where the lower number indicates the diastolic pressure. So, if it is more than 140 by 90, then the person will have hypertension. So, on 17th May, we celebrate World Hypertension Day, a day dedicated to the highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with a high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer. So ensure that your BP is measured and controlled if it is elevated. So the risk can be prevented and reduces by taking steps towards a healthy lifestyle such as regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, stress management, adherence to medicines. So few things I would like to explain about what we mean by regular exercise. Exercise can be it could be it's a drug free approach for to lowering the blood pressure. Regular physical activity makes a person heart stronger. If one have a strong and healthy heart, it can pump more blood with the less effort. So regular exercise it help also make it maintain a healthy weight, and which is in my opinion is an important way to control the blood pressure. One should aim at least 30-minute aerobic exercise activity most days of a week. High BP level can be reduced by doing a regular and a structured exercise such as brisk walking, jogging, or swimming. Healthy diet means we should have a Mediterranean diet, eating less saturated fat or total fat, getting plenty of potassium food, and limiting the amount of sodium in our diet. कच्चा नमक नहीं खाना है, मतलब अलग से पिकल्स और जिसमें हाई सोडियम है जिस फूड में लाइक पैकेट फूड, ये सब नहीं खाना है. अल्कोहल कंजम्पशन भी नहीं करना चाहिए. So these are the dietary parameters. And it also improves, like if we change, it also improves our blood pressure. A dietary regime should change. And quit smoking, it's very important. We should stop smoking. It helps our blood pressure return to normal. Quitting smoking can effectively reduce our risk of heart disease and improve overall health. So regular blood pressure monitoring. Some of hypertensive patients check their blood pressure by visiting doctors, but it is not always possible to visit doctors and check a blood pressure. So most often advise patient to self-monitoring of a BP level. Self-monitoring helps a person to measure BP at a different time throughout the day and over a longer period of time. It is assists doctors to get a more complete picture of a person's blood pressure reading at a different time. Further helps us to better prediction of the cardiovascular morbidity and mortality rather than a single or routine blood pressure measures, and that occurs during a clinical visit. Stress management is very important. Nowadays, learning how to relax, manage stress to improve emotional and physical health. It also lowering our high blood pressure. Stress management techniques like breathing exercise, listening music, focusing on something very calm or peaceful, meditation, these are very important. Adherence to medicine. The medicine to lower blood pressure may be recommended by the doctor if your blood pressure is consistently high, usually above the 140/90. Adherence to medicine is a very important as to control your blood pressure regularly. Like at least I would, like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy, long and healthy life. And high blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in a normal range is very important to preventing cardiovascular complications. It is very much possible to maintain normal blood pressure level with a regular monitoring and preventing care. Thank you so much.